What the business, YouTube? Episode 17. My name's Jay Florida, and today's career of discussion is a chiropractor. So, what is a chiropractor? A chiropractor is a licensed healthcare professional focused on diagnosing and treating musculoskeletal disorders, particularly of the spine, using non-surgical techniques like manual adjustments. They aim to improve joint mobility, reduce pain, and enhance overall physical function by manipulating the spine and joints. Now, to give you a piece of history, modern chiropractic was founded in 1895 by Daniel David Palmer in Davenport, Iowa, when he performed the first adjustment, making a modern profession over 130 years old, though it has its roots in ancient China, Egypt, and Rome, dating back 3000 to 1500 BC. Dr. Palmer is also known for founding the world's first chiropractic institution in 1897, now known as the Palmer College of Chiropractic. Now, a few basic requirements to becoming a chiropractor include completing undergraduate studies and obtaining a bachelor's degree, earning a Doctor of Chiropractic degree, passing a national board exam, and obtaining a state license to practice. Now, all of this can take you anywhere from 6 to 8 years and puts you in a hole as much as $150,000 to $300,000 or more. Now, as far as your range as an entry-level chiropractor, you can expect to make $45,000 to $80,000, with a few things affecting how much you take home being specialization, such as radiology or non-clinical, high volumes in practice, experience, and location. Now, a day in life as a chiropractor can be described as patient consultation, business management, timekeeping, and physically demanding, requiring stamina and dexterity. As far as opportunity goes, there's nothing in particular gatekeeping anybody from becoming a chiropractor. However, one could argue that the one prominent barrier would be how much it costs to become a chiropractor. However, barring that, the chiropractor does score green. Now, a few examples to take note of in this field include Dr. Josh Axe, a certified doctor of chiropractic and natural medicine, also a clinical nutritionist with a passion to help people live a healthy lifestyle, amassing over 2.5 million subscribers on YouTube through sharing medical advice, among other things. Next, we have Dr. Ace Thayer, who has been serving patients for over 25 years and is operating a successful chiropractic practice in Costa Mesa, California. Last but not least, we have Dr. Alex Vander Sheldon, a certified doctor of chiropractic, specializing in gentle, upper cervical, and diversified adjustments for families, athletes, and children since 2016, who is highly active on social media, amassing over 1 million followers on Instagram and working with the likes of Floyd Mayweather. Now, for our fact moment segment of this video, starting off with fact number 1, the crackle, snap, and popping of bones is medically known as crepitus, and if accompanied by pain, swelling, or reduced mobility, can indicate arthritis. Fact number 2, the word chiropractic is derived from two Greek words, chir, meaning hand, and praktikos, meaning done, when put together, meaning done by hand. And fact number 3, besides humans, chiropractors receive frequent visits, particularly from horses, dogs, and cats, to treat biomechanical and neurological issues. And for our last segment, before we move on to the circle of influence, we have health risks and mitigation. Now, the one prominent health risk that I find for chiropractors are chronic strain and musculoskeletal disorders as a result of repetitive motions and awkward positions. Now, to mitigate, you can use a drop table to perform ergonomic adjustments and physical conditioning through exercise. If you can think of any other health risks there might be, or find any other ones, leave them down in the comments. But that does it for our primary segment. I'm going to go ahead and give the floor to my co-host, let them take over for the circle of influence. Hey, when I say yo, you say duh. Yo. Okay then, we on the right track now, Birdie. We don't like that. Circle of influence. Starting off the list, we have respect. Is this a career or position that brings me respect and dignity? Now, for this segment, the chiropractor does score green, but I will say, if you know who Alan Harper is, boy, you would not think so. Moving on, we have growth. Is this a career or position that brings me the opportunity to grow from $100,000 earning threshold? Again, for this segment, the chiropractor does score green, with sources online citing that the chiropractor has the potential to make as much as $300,000 to $500,000 in a single year. Next, we have gore. Is this a career or position that will have me dealing with an abundance of blood, violent action, grotesque imagery, or scenery? Now, for this segment, the chiropractor also scores green, as in no, you will not be dealing with any of the mentioned before. And for our last ideological standpoint, we have moral conflict. Is this a career or position that will have me compromise any of my foreseeable morals? Don't lie, don't cheat, don't steal, don't kill, the basic set of guidelines. For this segment, the chiropractor does score green. Moving on to the ideological side of things, we have gender demographics, where men make up 70% of the industry and women make up 30% of the industry. Next, we have ethnic demographics, where Caucasians make up to 82% of the industry, Hispanics make 7% of the industry, and Asians make up 5% of the industry. Last but not least, location demographics, top paying states, no particular order, starting with Alaska, followed by Texas, then Oklahoma, Michigan, and finishing things off, we have Nevada. Now that does it for the circle of influence. I'm gonna go ahead and give the floor back to Florida. I'm back. So, to put the chiropractor in a summary, you can have it if you want it, you know. It's just gonna be one of those careers where the house is on top of the hill. You're just gonna be walking for a good while before you get there. It requires a lot of investing, you know, time-wise and money-wise. However, once you do get to the top of that hill, respect is in abundance. You know, I can't think of any doctor-esque line of career that doesn't bring respect and dignity, you know. You don't go through all of those years of schooling to not be respected, am I right? Especially when you have doctor, like, if you don't add that doctor, boy, they get on your butt about it. That's Dr. Alan Harper to you. Not Alan Harper, Dr. Alan Harper. And we have growth, of course, being in that doctor-esque line of work. It's no surprise that you have an abundance of room to grow. However, unlike most doctoring positions, you're not dealing with an abundance of blood. So I would take that as a plus, a major plus, big plus. With that being said, it does look like we have a full episode today. The word of the day is tender. Self-help resources on the board. As always, I'll leave it down in the description. And to show your support, if you want to see this kind of content more often, make sure to comment, like, or subscribe. And I'll see you guys on episode 18.